the videos and audio of the respective user, it will be great. Shall we start?
Yeah, should we start?
Yeah, we can. So good evening all. So I have Dr. Ali with me. It's my pleasure to host this meeting, and I feel that this will be a place where we can help the Indian pathologist to have a direct access to what's happening in the UK and also to have a certificate from Royal College. Over to you, Dr. Ali.
Thank you, Dr. Ranjith. So it's a pleasure really to be on this platform. Just if I can ask everyone to go on mute, that'd be great. So it's a really great opportunity to talk about hematology.
Dr. Ali, one second. Can you unmute yourself, Dr. Ali?
Can you hear me?
Yeah, I can.
That's okay. I don't know what you got of that earlier, but thank you for the kind introduction, Dr. Ranjith. And I'm really excited to give this presentation today and just talk about various things, generic things with regards to education, especially in the realm of hematology, and present an exciting project that me and Dr. Ranjith have been working together to try and improve people's understanding of hematology, laboratory and clinical aspects, and then finish off by just giving some information and maybe some advice for anyone who's thinking about working in the UK as a histopathologist or even as a hematologist as well. So thank you for the kind introduction and invitation. Is it possible for you to go onto a full screen mode?
Just give me a second.
It's just at the bottom to the right. Next, that's the one. Excellent. So really great to meet everyone. I can see we've got over 160 participants on the call, I've never been to India and I've always wanted to, and I've got plans to go in the near future, and it'd be great to actually meet you all in person, but we'll do this over Zoom at least. My name's Dr. Ali Mehdi. I'm a consulting hematologist. I work in the NHS. We're a bit odd in the UK because hematologists, we have a pathology hat on, and we also have a clinical hat on. So my pathology hat, which is the thing that I really enjoy, is the mostly malignant diagnosis of hematological disorders. I do a lot of work reporting flow cytometry. We do a lot of work within the diagnostic lab where I work in South Wales in the UK. But my clinical side is my interest in treating patients with myeloid malignancies, which is mostly chronic myeloid malignancies like chronic myeloid leukemia and myeloproliferative neoplasms. And I've been interested in medical education of hematology and various other things for probably over 10 years, and running courses on undergraduate and postgraduate level, as well as running postgraduate courses and revision materials, mostly for the FRC Path exam, as part of my website called Blood Academy. So lovely to meet you all, and a bit of background about myself. And the next slide, please. So continuous professional development is a key aspect of anyone who's interested in healthcare, who's an active role in healthcare, whether you be a laboratory scientist or whether you're a clinician, and whether you see patients or don't see patients, you're a pathologist, etc. And it's really important, especially in the field of hematology, as well as the other fields of medicine, because things are developing rapidly. The way that we diagnose patients, even for example, say for a condition such as acute myeloid leukemia, has changed rapidly over the past 10, 15 years or so. And that speed of development seems to be increasing at a number of rates that we can't even imagine. And because of that, it's becoming more and more difficult to keep up to date of the important things. And it's very easy to get drowned in a sea of information out there. And what do you need to learn? What do you not need to learn? How can we pick up all that important information within bite-sized nuggets and things that we can retain, and most importantly, allow us to improve the care of patients, the diagnostic sides of things as well, but also to try and improve our potential opportunities for employment and various other professional standards. So we have to think about what is the best way of trying to get all that information, distill it down, and try and keep up to date in a way which is engaging as well as useful as well. Can we go on to the next slide, please?
Sure.
So this is my personal experience of what are the difficulties and the challenges and hurdles which all of us face, unfortunately, in the modern world. If you're a trainee, or even if you're, a seasoned consultant and have been working in the job for long, because of the need for continuous professional development, there's always a balance and a risk that we're pulled away from other responsibilities that we have in our job. Especially, I mean, I'm not sure how it works in India, but in the UK, there's always pressures in terms of training opportunities to cover the clinical service. So instead of spending time looking down the microscope, getting all the experience from peers, etc., on how to diagnose this condition, what are the important things that we need to consider for, a whole range of different things, we're pulled towards covering a clinic and various other things. And hence there's always a limited opportunity to develop the competence in these laboratory aspects. For people who are thinking about doing the FRC Path exam for hematology or pathology or any of the other disciplines, we know that these kind of postgraduate exams are not easy. They are difficult. The Part 2 exam, for example, is a 3-day marathon. And I remember doing it just under 10 years ago. It's a very stressful experience for anyone to undertake. And the amount of information that you need to know is a challenge as well. And obviously these exams and all the things around them are very expensive. So you don't want to be wasting both your time and money doing these things. So again, this is a difficult area for people to get over. And I know that in the modern world that we can do things better instead of relying on textbooks and various other things. We've got access to digital pathology, digital slides. You're not limited to just what's available with your supervisor, your mentor, the person who's teaching you. And there's a whole range of online resources which is available, which basically breaks down any of the boundaries that were previously present in terms of gaining this knowledge and this important experience as well. And the other thing really is that, as well as it being accessible and online and up to date, etc., it has to be affordable as well, because certainly in the UK, and I think this is an issue which is a global problem, is that some of these resources are beyond the ability of people to afford as well. So we need to make sure that these things are also affordable on a financial basis. Next slide, please. So this is a project that me and Dr. Ranjit have been working on over the past few months or so, and this is really to try and use some of the content that I have developed through Blood Academy and through connections around the world with experts, to provide the platform of online courses within laboratory and clinical hematology, but mostly focusing on laboratory hematology. And these are based on video lectures, so engaging video lectures, which will cover the topics. We try to make things not too long, make them nice and compact for people to understand and make use of their time as much as possible, linking them in with assessments, so short quizzes, and provided that the assessment is passed, then we have our CPD certificates that you'll be issued with. And through my links with the Royal College of Pathologists in the UK, our courses are accredited by this organization. And potentially what we're thinking about doing is doing some live morphology training on a monthly basis as well, to really get that interaction, and almost as if you're sitting next to myself and saying, what is a blast cell? What do we need to look at if we see this feature? All these kind of things. So interaction with you guys is really important to both of us. There's a whole range of courses that we've built and we're planning on doing. At the moment, we have a real focus on laboratory hematology diagnostics, and that's mostly looking at morphology, flow cytometry, integration of genetic aspects, even things such as hemoglobinopathies as well. But also courses in transfusion, clinical hematology, and really we've been very fortunate that we've been able to get people from all around the world, in North America, in the UK, and I'm hoping that we can try and get some experts from India as well to do some of our courses as well. And this really is just to highlight that these courses will potentially, because the fact that you have a CPD certificate, they will certainly help you in terms of improving employment opportunities. Having these certificates in your portfolio will allow you to maybe think about different job opportunities, open the doors for other institutions that you may consider working with as well, because these courses, I truly believe that will allow you to get to the next level in terms of your career, as well as augmenting your laboratory and clinical knowledge as well. And for those people who are interested in taking postgraduate exams like the Royal College of Pathologists in the UK, then these courses will also help you in terms of the revision and getting over those difficult hurdles as well. Next slide, please. So this is an example of one of the certificates that you'd get after completing the course. And it's got the Royal College of Pathology stamped to it as well as my signature as well. And I think this is a good point to maybe go over the platform, Dr. Ranjith.
Yeah, I'll do it. Just a minute. Yes, give me a second. I'll just give you a quick run through of how the platform is going to work, and where this is the admin panel. This is not how it will be visible to you. So if you enroll to the course, once you enroll to the course, you will have this access of Royal College accredited certificate courses chapters. This will be available to every student from Monday. Now the pre-booking is started, and I'll be sharing the link with you guys. So we will be having 13 certificates in total. So the first entire thing is assessment of blood cells. So once you click on that, you get the RBC, platelet, lymphocytes, granulocytes, acute leukemia. These are basic morphologies. The purpose of this entire course is not just to teach you the hi-fi thing. So once the basics is sorted, then building up your knowledge, existing knowledge, as well as new things to learn is much easier. So it's made sure that when you go into morphology of RBCs, you'll have introduction, the change in shape, size, arrangement, inclusions, immature proliferations, everything, right? So like that same, if I just go for platelets, you'll have videos on thrombocytopenia, platelets, immature platelet proliferation and everything, right? So once you finish courses like this, at the end, you'll have an assessment. The assessment is something which is questions. I'm not going to show you the questions here. Everything, once you finish that, you'll have an access to a question. It's like a simple normal quiz, what you write. You have to answer the questions. Once you get the correct answer, once you clear the passing limit, Dr. Ali, the passing limit is supposed to be 100%, right?
That's correct, yeah.
So you have to get 100% correct to get the CPD certificates. So don't panic. You can attempt twice or thrice or any number of times. The goal of any foreign country as compared to India is to make sure you learn. So even if you make a mistake, you learn again and make it right. So it's not just if you don't know something and if you fail, it's the end of it, right? So you can attempt it multiple times, but only once you get 100% in all the CPD courses, you'll get the certificates. For everything, you'll have like assessment of platelets, blood cells, lymphocytes, granulocytes, and acute leukemia. Just go back once again. So then we have a CPD for major hemorrhages. So once you click on that, you'll have what are the important thing for your major hemorrhage protocols or the massive blood transfusion protocols, settings and everything. And the end of it, again, you'll have an assessment for this. The same way, you'll have courses on transfusions, immunophenotyping of AML, patient bed management, iron deficiency anemia, adverse reporting, UK legislation and governance. This is primarily very, very useful for anyone who's going to attempt FRC path. So you'll know everything what's happening in the UK, and you'll have courses on that, and also you'll have a certificate based on that, right? So in addition to this, there'll be couple of more things will be available: an advanced morphology course and a basic morphology course, which will help you to discuss cases where Dr. Ali and his team has been will use the digital slides and explain to you step by step how to approach to a case, diagnose the case, and manage the case. Plus, you'll have a repository of digital scan slides at your disposal. The scan slides will be available only on a laptop on the website, because the app is not able to support the huge amount of information, because you know that every scan slide is going to be consuming GBs of memory, right? So that will be available on laptop for every one of you. You can revisit it any point of time. And like Dr. Ali said, that monthly there'll be a live interactive courses. Whenever there's a case available, Dr. Ali and his team will be discussing with all of us how to approach step-by-step manner to diagnose as well as manage the patient. Fine. This is about the website, how it's going to look. And I'll be sharing the link with you for the pre-booking thing. And like I said, by Monday, you will have the courses available in your mobile phone or on your application as per in your login ID. Fine. That's all from me. I'll go back to the presentation so that Dr. Ali can complete the same. Fine. Just give me a second.
Thank you. So there are a number of questions on the chat. I'll go through them at the end of the presentation, if that's okay, and make sure that you do have any questions, and we'll go through them. So the second part of my talk is about working in the UK. I'm not sure how many of you guys have this thought in your mind at all, whether it's a serious one or, but I thought it'd be useful just to highlight a few things about the steps that need to be undertaken and completed for you to be eligible working in the UK as a pathologist or even as a hematologist as well. So let's go through that. Can I go through the next slide, please?
Sure.
So I'm going to just go over some background and just tell you that the situation in the UK, and particularly the NHS, the National Health Service, which is the national body which employs the vast majority of clinicians and pathologists, laboratory scientists, etc. That at the moment, and this has been the case probably since the NHS was first brought into existence, that there is a serious issue that needs to be dealt with regards to unfilled vacancies. There are a large number of hospitals, what we call trusts in England, that are really struggling in terms of recruiting and retaining their staff into a whole range of different roles. And these are not just short-term roles, but also long-term vacancies. And this is something which, as I pulled up from a report that was written, I think, 2 years ago by one of the parliamentary bodies in the UK, and highlighted that 15% of medical roles were unfilled within the NHS as a whole. And in particular, the vacancies were even higher when you looked at the hematology laboratories, which is almost a quarter. So, and these are for senior scientists, and the figures for hematologists as well, and I think even for pathologists, is around 15 to 20%. So the UK does have a major issue in terms of filling these posts. Next slide, please. The other issue as well is that this problem is potentially going to get worse over the next 10 years or so, if not longer. That we have an aging population, and that population is not just within the general population, but also within the population of hematologists that work within the NHS as well. And there's a staggering figure of almost 60% of consultants are expected to retire by 2030. Which is 10% higher than physicians in general over the UK as well. And there has been more difficulty in terms of recruiting into specialist training posts, because you need your trainees, unless you've got people from outside of the country to come in. You need your trainees to take over those new roles. And the number of people who are applying for training posts within hematology at least, and probably the same for pathology, has seen a significant drop as well. There are a number of different factors which we could talk about later, but it shows that the number of people retiring is high, and that's not being filled by the number of trainees which are coming through to fill those people who have retired as well. Add on top of that the complexities of diagnostics, of treating patients as well, patients are living for longer, we're diagnosing more patients, then really we've got a perfect storm as well. So there's certainly an opportunity for anyone, whether you want to consider coming over as a trainee and then becoming a consultant afterwards, or even working as a consultant within the UK. Next slide, please. So this really is highlighting this statement, which was a joint statement made by the Royal College of Physicians and Pathologists about 5 years ago, that the NHS is highly dependent from staff who have trained and who have vast experience outside of the UK. Things have become a little bit complicated within the EU because of Brexit, but the UK and the government, as well as various different organizations, recognize that workforce from outside the UK is vital for the running of the National Health Service. And this is highlighted in this statement here. Next slide, please. So what are the kind of things that need to be in place that you need to have for you to consider working in the UK? What I've tried to do in this slide is highlight the key requirements. And really, you can think about the key requirements in 4 parts. You need to show that you speak good English, and that's usually through an assessment like the IELTS examination. And my experience of anyone who's working and practicing in India is that the English proficiency is very, very good anyway. But there needs to be formal recognition of that. You need to have evidence and skills. And that can be either at a basic level, if you're thinking about training in the UK, of doing an examination called the PLAB exam, or if you're able to pass the FRC Path exam, you can skip your training route and potentially come to the UK and work as a hematology consultant as well. That does come with some challenges because you have to work within the clinical side of things, as well as the laboratory and diagnostic side as well. But potentially that's a route that if you get your FRC Path exam, get your qualification with the Royal College, then you've already shown that you have the knowledge and skills to practice within the UK within that particular field. You need to have a Tier 2 visa, which is often sponsored by an organization, which is usually an NHS institution, NHS trust. And you need to have full GMC registration. So for the visa, like I said, you usually need a sponsor, and that's relatively easy to obtain these days because of the large number of jobs available. And that visa lasts for 5 years. And I don't know whether any of you guys have been to the UK, but the visa is pretty much the same as a standard visit visa to the UK as well. So there's not a huge amount of difference between them, apart from the fact that you need that sponsor. For you to have GMC registration, so the GMC is the General Medical Council. It's the main body which looks after and regulates clinicians, doctors within the UK. And for you to have full registration, you need to show evidence of knowledge and skills. So either doing the PLAB or the FRC Path exam, and as well as having your visa and English proficiency, you'll be able to get GMC registration. But the main thing really is showing evidence of knowledge and skills is the most important thing. Next slide, please. So excellent. So we've got to the end of my presentation. Hopefully you find it useful in terms of an overview of CPD, as well as a view of the platform that we have. And any questions with regards to working in the UK, more than happy to answer, or any other questions regarding the other things that I've talked about. Again, I'll be more than happy to take as well.
Okay, thank you, Dr. Ali. I'll stop sharing the screen so that, yeah, just give me a second. Fine. So, guys, if you have any queries, you can ask one by one, and we'll try to answer most of your queries. Fine. Yes, Arshi, you will be able to answer it post 15 days. The content will be there like for 1 year for anyone who enrolls it. We'll go from the top so that if you miss anything, we won't be able to miss it. There's a question from a student that how the certification will be useful for a person who's going to settle in India. I will take this question. See, when you are going to look for a job opportunity in India, there are two things. One is a medical college job opportunity and a private laboratory thing. Be it any private lab, if you have an accreditation from any of the foreign things, you are considered a better person to settle than a person who doesn't have. That's one thing. You won't be like I said, or if you are in a medical college for promotions, you need few pointers where the certificate can really come handy. If you want to go outside India, CPD courses by the Royal College approved things are actually recognized in the Middle East. I think Dr. Ali's students are there in Middle East. So you will help if you're going to go abroad anywhere. This course certificate will definitely be help. I won't say this is the only thing which is required, but definitely they help you to build up your CV so that it will help you to land in a better place. Okay. Okay, there's a question from Dr. Reena. I think Dr. Ali will answer this. Is this really from Royal College of Pathology? Some of them are asking. So I'll leave it to you, Dr. Ali.
It's not. I don't work for the Royal College of Pathology, and I certainly don't have any influence in terms of their postgraduate exams. What the Royal College have kindly done, they've reviewed our courses, all of our material, and they've said that it meets the requirements for them to accredit the course. So it's not written by anyone associated with the Royal College, but they have reviewed it and they're happy to say that this is the courses, the assessments, all the materials are the standard that the Royal College will endorse.
Okay, to put into our perspective, when we have a certificate course which is approved by the NMC. NMC is National Medical Council of India. Like that, this is an approved certificate course by the Royal College, which is the governing body for the pathologist in UK. It's something similar to that. Dr. Reena, yes, the videos will be available in the laptop and tablet as well as in your mobile phone. Okay. Yes, Dr. Ali and his team will be conducting the course, and I'll be helping you to host and navigate you and helping you if there's any other question. You will have regular live sessions with Dr. Ali monthly as well. Chitresh has a question. Clinical part of management of hematological disorders, is it included here? Your take on that, Dr. Ali.
The current the majority of them are not. There are some parts where we'll talk about the clinical management. For example, you have a patient with polycythemia vera, for example. We won't just look at how you diagnose that on a genetic level, the bone marrow biopsy, etc., but also look at how you manage these patients. What are the most important things that need to be undertaken? We are looking over the next 6 to 12 months to have more clinical management courses as well. And we're looking at, this is a long-term project that me and Dr. Ranjith are looking to push forward. So at the moment, the vast majority of them are looking at laboratory hematology diagnostics, but there's some overlap with some clinical aspects of hematology as well.
Dr. Snehlata, you will be having access of this course for 12 months. That's 1 year. And yes, Raktan, these courses are certified. You will get a certificate once you complete the assessment. And like Dr. Ali previously said, that you should be getting 100%. Once you get the 100% thing, yes, you'll be getting the certificates with the seal of the stamp of the Royal College. Dr. Priyanka has a question that will there be live sessions or only recorded lectures?
Well, we're planning on doing a live session. So the live sessions will involve me going over different cases, mostly looking at blood cell morphology, bone marrow morphology, diagnostics. That's the plan. I think in the future, what we're hoping to do is trying to get other speakers to do these live sessions as well. So there is a plan. We haven't solidified those plans as yet, but we're hoping to try and run them in the next 6 months or so.
You will get the recorded lectures, which is required for certification, and the live classes will be there. It's like a case discussion of a month, which is going to, as you guys know, that pathology is ever evolving. It keeps on changing, and it's not just we have to wait for WHO every 4 years. Even before that, we have multiple changes happening. So the live course will help you to keep in pace with those changes, which is clinically relevant for practicing and diagnosis and management. Okay, Dr. Alka, the time limit is, like I said, 12 months. So that's in a year. Okay, Nupur Patel has a course, like what is the process of getting into clinical hematology? I think that's a course in India. We have, like in UK, we have FRC Path where the person takes care of the diagnosis as well as the management. We have clinical hematology in India where the same thing happens, diagnosis as well as management. That's for NEET SS. I think we should be discussing about that sometime later. Okay, Dr. Ali, Raktam Rai has a question that will the course grant me opportunity to work in UK based on this certificate?
Yeah, I mean, it will certainly support your application. So, for example, I mean, I've met a number of hematologists in the UK who have come over from India and various other countries, and what they've tended to do is they usually do the FRC Path Part 1 exam, and then they'll apply for a job, get a sponsor through that job as well, and the more that you can add on to your CV by doing online courses like this, which are accredited by the Royal College, the better and the higher the chance of you getting that job, that sponsor, and then potentially coming over as well. And these courses will also supplement your revision for the FRC Path exams as well. So there's certainly a number of direct and indirect ways that the courses will help you to get into the UK system. I sit on some bodies which review prospective trainees that are coming in from overseas, and anything that they have, especially if they've got their Part 1 exam, or if they've got any publications, or if they've done any courses which are accredited by international organizations like the Royal College or the American Society of Hematology, that certainly adds in terms of the weighting of that application as well, and higher the chance of them being shortlisted for that job. I hope that answers the question.
Thank you. This certificate is only for hematology. It doesn't include histopath and cytology. The entire group of teachers who are going to teach us are hematologists. So it will be provided based on hematology only. Is there any document to support the certification of the course? This is to Dr. Ali.
Well, we have a letter from the Royal College to say that they've reviewed and accredited the course as well. So that can be something. But I mean, we usually we provide you with certificates, and that should be okay. If you require anything else, any formal documentation, then you can get in touch with us. All the certificates are all individualized, so you'll have your name on there, and you'll have the date in terms of when the assessment was completed as well. So that's usually enough to suffice for any portfolio that you have or evidence that's needed to be presented.
Yeah, Dr. Ali, if you can share that letter from Royal College, I'll put it on the website so that it makes them it's a bit more authentic.
Definitely, yeah.
Dr. Srinivas, like I said, CPD certificates will have an added weightage in your CV, so it will help you to land a better job. This certificate is not going to guarantee you to get a job. The same way in the UK, it's a system. Like when you clear an FRC path, you have to give the FRC path part 2 in the UK. In between, you have to land up in some locum jobs. For the locum jobs, this certificate will definitely help you, because building up a CV is very important, especially once you become a consultant. For that, I feel that this definitely will be helpful. Dr. Abi has a question. What's after MD pathology? What's the procedure to work in the UK as a consultant? Dr. Ali, if you can take it.
So there are a number of different routes. You can start from the beginning. So you come to the UK, or even do your PLAB exam in wherever you're living in India, be that your case. And then after that, you start looking for attachment jobs to get experience. Obviously, you need your English proficiency exam. And then it's quite a long road if you're going down that route, because you usually have to do general medical jobs, surgical jobs, and then after that you apply to do pathology, etc. The quickest way of doing it is usually obviously doing the English proficiency exams, but trying to get your FRC Path exam. That's the quickest way of doing it. If you can show that you've got the FRC Path qualification, and you've got experience within that field outside of the UK, it's much easier to go straight into a job as a pathologist. There's always challenges from that perspective, because you're jumping in usually in the deep end at that point, because you may not know the system and all the procedures and various other things. But those can be quite quick. And to try and get a locum consultant post as a pathologist or hematologist is relatively straightforward these days, because of the large number of vacancies as well. So you can either go straight into via the FRC Path route, or go down the longer route, which is the PLAB route, and then going into training and various other things as well.
Dr. Pratik has a question that what is the difference between FRC histopathology and FRC hematology? Are they different? And I think you'll be the best person to guide what is the main difference between FRC hemat and FRC histopath, Dr. Ali.
So they're completely different. So in the UK at least, and probably the same in most countries around the world, histopathologists will deal with everything apart from the main things which hematology deal with. So hematology will deal with general hematology, diagnostics relating to blood and bone marrow, transfusion medicine, hemostasis and thrombosis, and transplantation, which overlies with transfusion medicine as well. Everything else within the realm of pathology has its own discipline. So we've got biochemistry, histopathology, etc. The histopathology exam essentially is looking at the diagnosis of conditions outside anything which doesn't involve the blood and bone marrow. Essentially, they will look at lymph nodes, and it's a bit of a gray area in terms of who diagnoses patients' samples from lymph nodes, but generally it's the realm of histopathology. If you do the FRC Path histopathology exam, you're looking for a job as a histopathologist where you won't be diagnosing, let alone managing patients with hematological issues, blood and bone marrow predominantly. If you do the FRC Path hematology exams and you want to come to the UK especially, then you're very likely to end up in a job where you'll be a pathologist as well as a clinician and looking after patients with hematological disorders. But there's a whole range of different jobs available, exactly the same in India as well. You could be a specialist in transfusion medicine where you don't deal with anything, you don't look at a flow cytometry report. You could be a specialist hematology diagnostician working in a big center, or you could be working in a small center where you undertake the bone marrow examinations yourself, you diagnose the patient, and you manage the patient all in yourself as well. So there's a whole range of different things that you can do.
Okay, there are a few more questions. There's a question from DNS doctor. He says that FRC path in hematology, are pathologists eligible for that? Or is it only for a clinically inclined person?
Well, they are. I mean, the way that I see it, if you undertake the FRC Path hematology exams, and it certainly opens the door for you to get jobs all around the world, I think, especially in India, and especially in the Gulf as well. So if you apply for a job in the Gulf, most of them will look for an FRC Path stamp of approval, that qualification for you to go straight in as a consultant to that point as well. Because of the fact that the FRC Path and the structure in the UK merges the clinical and the laboratory aspects of hematology, there may be a risk that you undertake the qualification and you may not end up using the clinical side of things as well. But it certainly adds to your CV and your opportunities for employment as well.
Okay, just to add to Dr. Ali, the similar situation what we have in India, MD pathology entering clinical hematology, that's what FRC path really does. So it's left to the doctor who's entering whether to go into the clinical side and manage patient or stick to the lab transfusion medicine of that sorts, which might not have a good amount of clinical loads. So that's what it is. So pathologists will be able to give an FRC hemat. And there are a few more questions like, will these certificates help them in working in Middle East, Australia? And how will these certificates boost their FRC path prep or the guidance in that way? Dr. Ali, if you can take it.
So in terms of preparing for the FRC Path, most of the material that we have is very much tailored for someone looking to pass the exams. We've tried, one of the principles that we had was that all the content, all the material, our teaching style was to cover both the exam and for general learning for whatever you do as well. So those are the two key principles that run through all of the courses. Will it help you in terms of getting a job in the Gulf or Australia? Definitely the Gulf. I know a number of my colleagues we have a number of institutions in the Gulf who are actually using these courses as well. And like I said, if it's accredited by the Royal College, which the vast majority of hospitals, private organizations in the Gulf, they recognize the Royal College and the accreditation from them as something which adds value to that person, and you're more likely to be offered a job potentially there. In terms of Australia, the Australians have their own postgraduate exams, something called the RCPA. They have their own pathology accreditation system there. So we don't have it will help you, but not as much, I think, as places in the UK, India, and the Gulf. We do have a number of people from Australia using the courses as well, and they found it very, very useful. But there may be slight difference in terms of the accreditation, but that's something that we can look to in the future if it's getting accreditation from the RCPA as well, if there's sufficient demand.
Okay, great. I think we'll put an end to this. Like, there are a few of the queries which are not answered. I'll definitely take it and put it to Dr. Ali, and we will have frequent live sessions like this so that you can clear your doubts on the path to UK or path to other places in the country, and we'll definitely be able to guide you. As of now, there's a certificate course. You'll be getting the certificate to your registered address. If you don't have the address in the app, please add them. And yes, you will be getting the certificate once you complete one of the course. You'll get one certificate. But I would say for the ease of everything, if you complete all the 13 courses, that will be much comfortable to send it as a 13 bulk. But if you feel that you want it every one and then, that also can be done. That's not a concern. Fine. Thank you guys for your time. I have shared the number in the chat box. You can ping me at any point of time. As of now, I don't have any courses for histopathology. Maybe we will look forward, and I think Dr. Ali will help us to spread this spectrum apart, just not restricted to hematology, and we'll go to histopathology and cytology and clinical pathology as well. Fine. Thank you, Dr. Ali. Thank you for your time.
Thank you. Thank you, everyone. All the best. Bye-bye.